Welcome to Doctors on Call. I'm Jenna Miller. The coronavirus pandemic has now infected more than 20 million people in the United States. There has been more than 350,000 COVID-related deaths. Right here in Kansas, the numbers have increased to more than 230,000 cases and nearly 3,000 deaths. What can we do to protect ourselves and our families? Will the new vaccines help to slow down the number of cases? Kansas ranks among the states with the lowest number of vaccinations available. We'll tackle these issues and more on Doctors on Call with our guest, family physician, Dr. Tyrel Somers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from at Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.
Dr. Somers received his medical degree from the University of Kansas School of Medicine in Kansas City. He completed his residency at the University of North Dakota Center for Family Medicine in Bismarck, North Dakota. Dr. Somers is board certified through the American Board of Family Medicine and is a member of the Kansas Academy of Family Physicians, American Academy of Family Physicians, and the American Medical Association. His professional interests include chronic care management, gastroenterology, pain management, and psychiatric disorders. Dr. Somers has been affiliated with Russell Regional Hospital since 2015. Our phone lines are open at 800-337-4788 toll-free if you have any questions regarding the coronavirus on today's show. Doctors on information which may be useful to you when you see your own physician. We'll go ahead and get started with some questions of our own. Thanks so much for joining us again. Let's start by talking about the common symptoms of the coronavirus.
So the common symptoms we see with people who have coronavirus is primarily these. They'll have cough, sometimes a sore throat, runny nose, fevers, muscle aches, and joint aches. If the coronavirus becomes worsened, we typically see people get even more short of breath, have even worsening cough. They become very tired. They might complain of headaches, but really have problems with their oxygen levels staying high. And that's kind of what gets the more severe individual with COVID.
How does a person differentiate from the flu, from cold, allergies, COVID? It's a little confusing.
It is. And the hardest part is that we also have a lot of individuals end up being asymptomatic carriers, meaning that they don't have any symptoms whatsoever. So it's very, very tricky during this time of year when we normally have just cold and flu season to begin with to differentiate between them. So the biggest thing is talking with a physician, talking with a provider to basically discuss what type of symptoms that you're having. For the most part, we're just testing pretty much anybody that has any of those symptoms that could be COVID because we just don't know, unfortunately, at this time.
You mentioned asymptomatic. I think that's a little confusing as well. Let's talk about what that is.
Yeah, so the trickiest thing about COVID-19 as compared to other types of common cold like viruses is that there's a good portion of the population that when they receive the virus in their system, they actually don't really have any symptoms. They might have maybe a light runny nose, which can look very similar to like allergic allergies more than anything else. So it's very, very tricky in that they may not feel bad. They may not present with a normal cold, but they still carry the virus in a high enough load that they can infect other individuals. And so they can easily spread the virus and give it to somebody who might be immunocompromised or someone who might have chronic medical conditions that could set them up for complications with the virus.
Now, is there any truth behind, I've seen some studies out there that say asymptomatic people cannot spread the virus. Is there any truth to that, or are they still trying to figure that out?
We know that the asymptomatic people are primarily capable of spreading the disease, for sure. And that's why we've pushed so much recently for like public health measures to help minimize the spread of individuals who have the virus and those who are asymptomatic that we think could have the virus. That's why we've seen a lot more like uses of masks and different counties coming out with like mask ordinances to try to encourage mask wearing to help minimize that spread. The other thing too is we're trying to limit the number of big large gatherings to help minimize that spread as well. Because if you have one individual who's asymptomatic that comes to a larger gathering and does not wear a mask and does not distance the way that they should, you can have multiple individuals within that specific event that become infected. That's just that so-called super spreader event that you might hear on from like other news networks, other kind of things that you'll see.
Okay, if a person has been infected once, Can they be reinfected?
So that's a very interesting question. For the most part, the answer to that is no. Once an individual has been infected with COVID-19, they have immune cells that kind of form a memory to the virus itself, so they're able to fight it off a second time if they see it. With that being said, there are some people who have a weakened immune response to COVID-19, so it is possible that they get reinfected, but the chance of a reinfection rate seems to be particularly low.
So how do you feel about people thinking they just might as well get infected and get it over with?
So the hardest part about that kind of thinking is that if we have a massive spread of COVID-19 kind of everywhere in a given population, you can overrun and kind of overtax the health system. When you do that, it kind of causes a lot of problems because most individuals don't have severe symptoms, but those that do require hospitalization. They require oxygen supplementation. Sometimes they even require ventilation with like machines that help keep them kind of stable and keep them alive. With that being said, if you overrun a medical system and they can't provide those basic cares for individuals, you kind of get to a point where you have to choose which individuals receive that care and which individuals don't. And so by slowing down kind of the spread and kind of flattening the curve, we can minimize the number of people that go into that system and hopefully provide the best medical care for them.
Where are we in the curve? We heard that back in the spring of last year that we were trying to flatten that curve, but it doesn't seem like it's happening yet. Or is it?
Yeah, that's the hardest part is that, regardless of the measures that we take as scientists, as physicians, as providers, there's still people that go out and still people that spread the virus regardless. And we're not going to slow that down no matter what we try. We've definitely seen some measures that have improved and decreased risks. Specifically, mask wearing has been shown multiple times in studies to reduce the spread of COVID-19. But even then, we don't see 100% that curve flattening. In the studies that we've looked at and kind of how the populations have worked in the United States, at least, we've seen 3 different kind of spikes of COVID-19. The first one happened right at the beginning in March, kind of April in that time, but then kind of got better as we kind of locked down at that point. We saw a secondary kind of spike in the middle of July, and that's kind of when we started really pushing mass kind of ordinances, measures out to kind of minimize that spread. And then, of course, with school restarting and with universities restarting, we started to see another spike that happened in September, October, in that time frame. Unfortunately, we're still in the middle of that spike. We really haven't seen the measures to minimize really the numbers that we were expecting to and hoping to see.
Okay, we're going to go to the phone lines. We've got a caller, I believe they said Will from Sylvan Grove is on the line. Go ahead with your question. Are you there, Will?
Yes.
Okay, go ahead with your question for Dr. Somers.
I just wanted to find out, is there any way that if you had the coronavirus, that you wouldn't even have known you had it?
Sorry, I missed.
He's asking is there a chance that you had the coronavirus and didn't even know you had it?
Oh yes, very much so. There's a good number of individuals who might have been asymptomatic and would easily have the coronavirus and not known it. By far, kind of the best way to know if that's the case is there is antigen-based testing that you can sometimes get that will show whether you've been exposed or not. It's not foolproof. There are some people who are probably exposed that we don't know. Another good indication is if you had someone that was very close to you, like a loved one or someone, a significant other that was nearby you that was tested positive for coronavirus, with its infectivity rate, it's very likely that you also had COVID-19. Good question, though, Will. Thank you.
No, I saw.
Thank you.
Do you have any other questions, Will? Okay. All right. Very good. Now, I recently saw a report that said Kansas, I believe, is like in the top 10 of, in the country right now. But at what point, are we just a little bit behind? Did it catch up to us? It was in other states, the summer a little bit higher. How do you feel about that?
Yeah, so initially, Kansas wasn't really infected with the very first spike that we saw in March and April. I didn't even really see a case in the county where I take care of patients until July. That was really the first time we saw a single case of COVID-19 in Russell, Kansas. We've kind of seen a large uptake when school kind of happened here specifically, and really in October and November is when our cases started to skyrocket and take off. And I think that's pretty universal for most of Kansas. I know some of the metropolitan areas in like Wichita, Topeka, Lawrence, Manhattan, and Kansas City did have a little bit of bigger spikes in July, but for the most part we didn't really see as much during that really initial phase when the lockdown occurred. It's probably that, yes. Kansas is kind of a little bit more remote, and so our spread of the virus wasn't as quick as we saw in some of the more metropolitan areas, especially in rural Kansas itself. But I think the studies have shown, and kind of the statistics show, that we're just as susceptible as everyone else in receiving this virus and getting this virus. And so now we're seeing a good number of cases kind of increase. And again, by far the biggest and most important thing that we can do as people is to continue wearing our mask, continuing to distance, limiting the number of large gatherings that we're doing to help kind of decrease the spread of the virus.
At what point do you call your doctor to get tested?
I honestly encourage a lot of my patients and a lot of other people that if they're having any symptoms whatsoever of the coronavirus that I mentioned earlier, fevers, coughs, runny nose, sore throat, feeling short of breath, anything like that, they should probably be tested or at least discuss with a provider the possibility of receiving COVID-19 testing.
And how do you feel about people who maybe, they're giving a lot of free tests? If a person doesn't have any symptoms, you do hear of people just getting tested kind of for the fun of it, and then it turns out positive. How do you feel about that?
So that's really, really tough because what we use is an antigen-based test that is kind of shown if you've been exposed to COVID-19 or not. It doesn't necessarily tell us when that was, and so it's possible that, let's say you had a little bit of a runny nose back in October, and you get tested now kind of just off the whim because of the free testing that's happening, and you test positive. It's hard to say if you're actively having COVID-19 at that point or not, or if you were just exposed to it in the past. So it's kind of a tricky thing as a provider trying to give an individual kind of some guidance in what to do in that regards. We try to limit their exposure at that point, just assuming that they're positive then. Regardless, if you want to have free testing done, there are several sites that do it kind of all around the state. I know there's some in Hayes, there's some in Russell, Salina has some testing, I think even Ellsworth had testing for a period of time. It's completely legitimate and completely understandable to want to be tested for this virus. I wouldn't discourage anyone from doing it.
Is every test the same, or are they different?
There are actually multiple different kinds of tests, and I'll try to explain as best I can the difference between them. The first one is a rapid test. It's an antigen-based test where we basically can test in a very short period of time if you have an antigen to that specific virus or not. The problem with that test is you had to have seen enough of the virus to form that antigen in order to see it. And so sometimes in the very early portions of infection, it's not positive, and that's probably one of the things that scares people the most. They have the symptoms, they get tested with this rapid test, and it really doesn't come back positive. The secondary types of tests is what's called a polymerase chain reaction, or PCR-based test. That's looking specifically for the nucleic acids that exist within this virus, and it's easier to detect at lower viral loads, and so they will sometimes be positive. Those are the ones that you see in those kind of send-out tests that we have individuals do. So the ones that take like 2-4 days to come back that go to an outside lab, those are normally the ones that occur via PCR.
Excellent. We're going to go to the phone lines again. We've got Casey on the line from Winfield. Hi, Casey. Go ahead with your question about the coronavirus for Dr. Somers. You are live on the air. Go ahead with your question.
Hello again, Dr. Somers.
Hey.
I'm a 70-year-old individual, and I'm concerned with what I can do to increase my immune system during the COVID. So thank you.
Thank you so much for your great question. Asking specifically about what kind of things we can do to help strengthen our own immune system, especially against COVID-19, but this is really true for anything. The biggest thing is keeping yourself healthy, keeping yourself active, keeping yourself well, making sure that you're eating a balanced diet really does help. There's been studies in different people that believe like zinc, vitamin C, and vitamin D kind of help minimize that risk. To say that it's backed up clinically with science isn't 100% there. It doesn't cause any problems to take those supplementations though. So if you feel comfortable doing that, that's completely reasonable. That's completely all right to do. But again, by far the most important thing is making sure that you're staying healthy and staying active, staying fit if you can.
Okay, back to the phone lines we go. We've got a caller from Wichita. Go ahead with your question for Dr. Somers. You are live on the air. We're ready for your call.
Hi, can you hear me?
I believe they said Janie from Wichita.
Yes, I can hear you. Can you hear me?
Janie, are you there?
Yes, I'm here. Can you hear
We
me?
must have lost her. All right, well, give us a call back if you still have a question for Dr. Somers. Let's talk about quarantine and what those requirements are right now.
So quarantine is something that's dedicated specifically by the health department in your specific county or by the state, depending. Quarantine is something that you're placed in to help minimize the spread of the virus. Based upon your kind of job and what you do, your quarantine lengths might vary. Sometimes it goes anywhere between about 10 to 14 days from when symptoms started. But the most important thing is quarantine is exactly that. You need to stay at home. You need to stay away from other individuals, not go out, not spread this virus. Even with a mask, you can still spread it. And so we're asking individuals, if you've been identified as needing to quarantine, you need to stay at home. Again, the important thing to remember is the only people that can dictate that is the health departments, whether that be your county health department or your city health department or your state health department.
How long is a person considered contagious?
So contagiousness with the disease varies, depends upon the individual. We see the highest amount of kind of viral shed anywhere between about 2 days to about 5 days. But honestly, you can be contagious up to 2 weeks after you get it. The other hard thing is some people don't even start showing symptoms until day 3. And so they can be a whole day of infectivity, of being contagious without even knowing that they are. And so that's why wearing masks, that's why distancing is so important. Because I can already be sick and spread the virus without even knowing.
Okay, what information do you have on the few vaccines that are available now?
That's a great question. We're very excited about the new vaccines that are coming out, but there's a lot of questions because it's a whole different type of vaccine than we've ever done. This is a messenger RNA-based vaccine, which is one that uses a genetic code from the virus itself, well, not from the virus, but of the virus itself, to help us get immunity to it. How it works is there's a very specific protein on the surface of the virus that we react to, that we can produce antibodies to, that we can fight the virus. So if we see those specific proteins early on, we can form antibodies so that when the virus does come, we can mount a very quick and very aggressive immune response against it. Meaning we can prevent infectivity, we can prevent spread of the virus, we can kind of stop it altogether. The biggest difference in how it's delivered via your own cells that make this S protein. Some people might be scared in that we're introducing RNA to a person. However, mRNA, which is the specific type of stuff that we're using, breaks down within the cytoplasm. It never enters your own genetic code. And that's very important to remember. This specific type of vaccine will not change our own genetic code, which is very safe and very good.
Okay, we're going to try Janie back on the line from Wichita. Hi, Janie. Go ahead with your question for Dr. Somers.
Hi, can you hear me?
Yes, go ahead with your question.
Great. So I have a pre-condition that my doctor does not want me wearing a mask, and I was just wondering if you have any suggestions for going out in public and
Yeah, thank you for the question. I heard a little bit of it. From what I can tell, you have a pre-existing condition where your physician has asked you not to wear like a cloth face mask or like a paper face mask. And so if there's any precautions, guidelines that you can use to kind of minimize your chances of receiving the virus. By far, one of the biggest things that you can wear if you're having a problem with a face mask is to wear like a facial shield. There's a whole bunch of different options that are available, but basically anything that is like a plexiglass or plastic-like shield that protects the T-zone, which is between the nose kind of to the eyes itself and down along the mouth is beneficial. Anything you can help do to help reduce droplet spread would be very important and crucial for you to be using. So that's a great question. Thank you.
Along with that, who might be a candidate for not wearing a mask?
It's very, very tough to say. A physician will and a provider will evaluate that one-on-one with the patient. For the most part, the majority of individuals should be wearing a mask. The only ones that I've really been giving exceptions to are individuals who have really bad like facial burns, in which wearing a mask would cause kind of problems with it. Individuals who have certain dermatological conditions, sometimes they're given exceptions. For the most part, individuals who have like extremely severe lung conditions may be given exemption. But I'll be honest with you, I really encourage a lot of my patients, even if it's uncomfortable, to try to at least wear some type of mask device.
And what should a person do if, let's say, they cannot wear a mask? If they go, out in public to, they might be approached and told, you need to get your mask on. What should they do? So
the biggest thing I encourage people to remember is that private businesses can dictate what an individual wears and how they wear it. So please be understanding that that's a decision that was made specifically by that business, and to respect their decisions. There's no need to become upset. There's no need to become frustrated. There's no need to blame doctors or other people for having to wear that mask. It's specifically the business that's just asking cordially for you to wear that. It is up to them whether you have to wear that mask or not. And so when they ask, you do need to put it on or find another place to go, unfortunately. If you're trying to minimize spread while not wearing a mask, the big thing I would say is using like drive-up or curbside services are very, very beneficial and helpful. So for example, like you can get like curbside grocery shopping, curbside pickup for meals is very much readily available now. I'd use a lot of those services for sure.
Okay. Hand sanitizer right now is in high demand. How effective is it?
It's very effective. We're showing anywhere between about 99.9%, 99.8% elimination of the viruses if done properly. The best way to use it is to get about a quarter size amount into your hand, rubbing that together as much as possible, then rubbing between the kind of interlacings of the fingers, and making sure, of course, to get the backside of it as well. So you need a good amount of hand sanitizer. That's the most important thing, but then also applying it properly. I see, like, my kids are very guilty of this. They'll put a small amount in and they rub like this and they're done. And that doesn't really 100% reduce your risk of getting something onto you.
Is there any truth that you can build up an immunity should you switch up your kind of hand sanitizer that you're using?
No, not really. Honestly, whatever hand sanitizers that you can get that's available, you can use. You don't need to switch from like a specific brand to another brand. That's not necessary.
Okay. We're going to go back to the phone lines. We've got Kathy on the line from Salina. Hello, Kathy. You are live on the air with Doctors on Call. Go ahead with your question.
Hi, this is Kathy.
Hi, Kathy.
And I have a problem with my lungs and my sinuses, and I've been that way ever since I was 8 years old, and now I'm 66. And so I live with a head or a chest cold. Will I be able to get the coronavirus sooner? I mean the vaccination.
Yeah, that's a great question. Definitely there are some certain things that make people more at risk and would be a higher priority for receiving the vaccine. Unfortunately, I can't specifically speak in regards to like how quick it would be till you receive the vaccine. With what we're doing in Russell County, I can at least tell you our plans are to kind of prioritize individuals that are at higher risk. So it sounds like that would be you, individuals over the age of like 65, individuals who have chronic medical conditions that place them at risk are all kind of being prioritized over other individuals.
Now, it was recently reported, I believe, that Florida had a new strain of coronavirus coming out so that the vaccines would not be effective for that new strain. What do you know about that?
So there have actually been multiple different strains of the coronavirus that have come out over the last month or so. There's one in the United Kingdom. There was also one that came out in South Africa. The newest one came out in Florida. There's a whole bunch of different ones. The hardest part about this is the coronavirus naturally mutates. It changes with time. If you remember last time when I came in and I talked, I said the coronavirus is something that we've known about and seen many times in cold and flu season. It's a very common cause of the common cold. But the problem is that it mutates quickly. So getting immunity to it is tricky and difficult. Specifically, this strain that we're seeing mutated causes a difference in that spike protein sometimes. And as I mentioned earlier, the mRNA vaccine is specifically against the spike protein that we see. So if there's a change genetically in the virus, there's a possibility that the vaccine may not do some coverage for it. With that being said, I wouldn't discourage anyone from receiving the COVID-19 vaccine. As a matter of fact, just like with influenza, we kind of guess in regards to what strains we'll see in a given flu season. Because of that, we don't get it perfect. But getting the vaccine does help minimize the severity. It minimizes the chances of an individual getting the influenza, and then also minimizes the chance of them being hospitalized. From what we can tell, we believe the coronavirus vaccine will do that too, minimizing severity, minimizing the chance of continued hospitalization or more care needed.
Okay, we're going to go back to the phone lines. We've got Yvonne from Great Bend. Hi, Yvonne. Go ahead with your question. Yvonne, are you there?
Yes, I am.
Okay, go ahead with your question for the doctor.
Yes, I have what they call vasculitis of the arteries. Does that mean I am at a higher risk and that I could get the vaccine sooner?
Yes, thank you for that specific question. Yeah, when you're dealing with a vasculitis, that's a form of an autoimmune-based disease. So you are at higher risk in regards to obtaining COVID-19 and getting infected with it. So you would be a little bit more of a priority for the coronavirus vaccine. Again, I can't speak specifically in regards to what the plans are in your specific area in rollout of a vaccine. But I would say that you're a little bit higher risk than someone else that's your age who's a healthy individual.
Okay, if a person is diagnosed, what is your protocol for treating that person?
So it's tough depending upon where the individual is in infection because it kind of varies depending upon their risk factors. It varies depending upon the day that they present. So, for example, if an individual is very early on in the infectivity and in the disease itself, and also is a very high-risk individual, there's different treatments that are available. One of the things that we've been doing in Russell, Kansas, is we've given out monoclonal antibodies to help reduce the chance of progressing to a worsening form of COVID-19. If an individual is hospitalized, sometimes we'll put them on an antiviral medication to help reduce the chances of it worsening. We also give dexamethasone, which is a form of a steroid medication to help with breathing, to help minimize inflammation, and to reduce the chances of them progressing into a more severe form of COVID-19. There's also oxygen that we deliver. There's a whole bunch of interventions that we do for treatment. And again, it all just depends upon what stage of the disease you're at that point.
Excellent. Well, our thanks goes out to Dr. Tyrel Somers for being our guest tonight. We will actually see him a little later on in the season to give us another update on the coronavirus. On our next Doctors on Call, we'll be discussing chiropractic care. You can email questions for our next program. That address is doctors@smokyyhillspbs.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from At Blue Cross Blue Shield of Kansas. We're committed to being a healthcare partner you can turn to. That's why we're simplifying the health insurance experience so you can feel more empowered in your health.
Russell Regional Hospital, experts, neighbors, friends.